Welcome, viewers, to the final episode of the series, Exploring Careers in Public Health. This episode is entitled, Preparing for the New Normal, How COVID-19 Will Change Healthcare. My name is Jeff Sawyer, and I'm the Director of Employer and Professional Network Development in Middlebury College's Center for Careers and Internships. I'm joined today by Chris Bernene, class of 1990. And a founding partner in Oliver Wyman's health and life sciences practice. Chris has been with Oliver Wyman for over 20 years and has expertise spanning a broad range of strategic issues facing health plans, including consumer strategy, digital healthcare, healthcare financing, distribution strategy, and ancillary product strategy. Chris received a BA in English summa cum laude from Middlebury College, a Master's of Philosophy and English Literature from the University of Oxford, and an MBA from the Amos Tuck School of Business at Dartmouth College. In addition to being regularly involved in his class year's reunion planning, Chris has also been very active within the Middlebury Professional Network as a participant in CCI on-campus career programming, recruiting on campus for Oliver Wyman, and in the CCI Summertime Consulting Case Interview Mentoring Program. Welcome, Chris. It's great to see you.
Thanks, Jeff. It's great to be here virtually. Wish we could be at Middlebury in person, but we'll do this virtually today.
Yeah, we'll get there, I'm sure. So, Chris, the current pandemic environment has challenged everyone to change their normal day-to-day routines and habits. You consult to many organizations in the healthcare field who are in the front lines of dealing with COVID-19. What will you be sharing with us today?
Well, there's a lot to share for sure, but I'll focus in today on the impact to the healthcare industry overall. So thinking about how is the industry being impacted by the pandemic, how are things be different during and right after the pandemic, and what's the new normal going to look like whenever we get there.
Great. We're in your hands.
Okay, super. Well, so it's great to be here today, and I'm always so happy to do what I can for Middlebury. I think next week I was going to be on campus for my 30th reunion. It was a long time ago when I was actually on campus, and very disappointed not to be there, especially on a beautiful spring day. So thank you for having me. As Jeff mentioned, I've been doing this a long time, this being management consulting, but I've actually been here for 24 years now. One of the great things about having a lot of experience and seeing a lot of different markets is that when we think about things like the new normal, we recognize that there are parts of this which are similar to crises in the past, right? And having done this for a while now, there have been three major crises that I've lived through in my business career. And even though there's some parts of the crises which are common, one of the things I've also known, and this is kind of going back to my English literature days, but from Anna Karenina, for those who have read that, the book starts off saying all happy families are alike, but an unhappy family isn't happy in its own fashion. And some of that is true when we start to talk about crises as well. So each one, if we think about 9/11, which was something that happened early in my career and was traumatic on many levels. This was a crisis caused by, centered on aviation, centered on terrorism, obviously, and centered on specific geographies. There were specific localities that were impacted. And the new normal that emerged from 9/11 were a changed geo-landscape, different ways of traveling, which, the before and the after ways that you would fly in airplanes was, forever different. And new categories of risk, and just the way that we all look at the world was different then. The 2008 global financial crisis, for those who have seen The Big Short or read The Big Short or lived through this, this was a banking crisis, right? This was caused by unprecedented levels of risk taken by banks and mortgage companies and people getting ahead of themselves in terms of the ability to truly underwrite risk and understand the profile of sort of risk that you were taking on. And this forever changed the way that the banking industry was regulated and the way that everybody looked at Wall Street and the way that people looked at different parts of the finance economy as a result. And the world was changed. And so we know that there's going to be a new normal that comes out of COVID-19. We don't know what that's going to be yet. I'll offer up some thoughts today, both in terms of what that might be and also just when we're going to get to what this new normal might be. And both those are big questions with a high degree of uncertainty around them. If we think about, so talk about both those as we go through here, but just first thinking about the timing dimension of this, it's one of the frustrating things about sort of where we are is that we are at the end of the beginning, right? I mean, that's probably the safest way to put it. We are in the United States now coming out of the initial outbreak where there was the severe spike up in cases, which then caused the lockdown, and various different parts of the country have been on slightly different timelines with this and different levels of severity. But in general, we are starting to emerge from this initial phase of sort of the shock of it, and then also the complete lockdown in many parts of the country. That's the good news. The harder news is that we're entering right now what we've called the long haul of suppression, which is likely to take the form over the coming months of a resurgence of cases in certain parts of the countries, a re-emergence of lockdowns and different sorts of social distancing that gets dialed up and dialed down. But it's likely we're going to go through a phase here where this is going to be a sustained temporary normal that we're in. This is all going to be the period before there's a vaccine and there's a proven set of therapeutics to deal with the underlying conditions of COVID-19. When that happens, we will at that point enter a phase of containment or something that's going to start to look more like a new normal, because it's going to be more of a go forward, stable environment, both on the business and the social fronts of what that's going to look like. Again, I'm not making any predictions here about how long this period is going to last, and every day there's new news coming out about Moderna's therapy drug. The vaccine was in the news yesterday about positive trials. So we're all really, really hopeful that science is going to get ahead of this, and the 12 months will get shrunk. But thinking about this, realistically and what the most likely scenarios are, it's going to be something that's probably going to be of that order. So as we go into this long haul of suppression, it has a lot of implications. And we're only going to cover a couple as I go through my comments here. But one of the characteristics I think that's been well noted about this crisis, and especially painful about it, is that the impact on different industries has gone from mild to extreme, catastrophic impact in some industries. As in the press, you read constantly about the pressures that small businesses are under. So the small business portion of the economy has been really, really devastated over the past couple months. And we've all seen that with our local restaurants and dry cleaners and gyms and all the rest of it. It's been really hard hit. And more broadly in corporate America, some industries have really almost literally gone to zero. Airlines and hotels and some of the travel and leisure, all of that, the cruise lines are well documented. And one of the things I see working in a big consulting firm is that while I focus on the healthcare industry, my partners across the board covering other industries, our business is following sort of what's on the page here. So we've got some parts of our firm that are not doing client work right now, and we're trying to help our clients survive. And other parts of our firm are helping clients start to plan for the next wave and the new normal. And it's been all over the board. And we all feel this, and we feel this at a very personal level also, as someone who's traveled probably 3 or 4 times a week for the last 24 years for my job. That went to zero 2 months ago, and I haven't been on a plane and since then. So on one hand, it's been nice to be here with my family. On the other hand, it's hard to do our job that way, and it's been hard on the industry. So it's really been up or down and mostly down, but there's been a few brighter spots. But in general, it's been hard across the board. It's a similar story that I'd comment on in healthcare. And one of the questions that we get a lot from people that aren't as close to the industry and thinking about what's going on, the natural assumption is that wow, all the focus has been on healthcare for this. So, this must be, this is going to be from a business standpoint, what's that going to mean for healthcare companies? Isn't it all going to be good? And the sad irony of the situation is that the part of the healthcare system that's been most impacted by just the crisis and the health crisis that's in front of us, the hospitals, the providers, the economic consequences of this have been quite dire on their businesses. And the first 3 rows of the slide that's on the screen here are around health systems and hospital change and providers. Their business has been severely impacted because in serving COVID and clearing the decks to serve COVID, all of the other parts of their operations around clinical procedures that they would do and lab tests and x-rays and all of that sort of stuff that generate revenue for hospitals, that part has gone away, and it went away almost instantly. And so as a result, there have been severe strains on the provider and hospital parts of the ecosystem. So that's on one hand. On the other hand, thinking about other parts of the system that have had different impacts of it, there's been virtual care and telemedicine specifically has gone through the roof. A few weeks ago, at the beginning of the crisis, telemedicine was growing at 50% per week in terms of usage. So literally, the business doubling over the course of 2 weeks and quadrupled over the course of 4 weeks in terms of the amount of usage and the volume of televisits that were happening. Was truly incredible. So there are questions about that, which I'll comment on in a couple minutes about the long-term sustainability of that, but clearly a spike up in finding ways to provide care in different types of settings. So not in-person settings, but other settings. Similarly, other parts of the ecosystem also have seen financial benefits from what's been going on. Health plans, insurance companies, all of them reported very strong quarters of profitability because basically they're not paying claims. There are no claims for the same reason that there's no people in the hospital getting procedures done. And so as a result, what hurts the economics of the hospital benefits the economics of the payer. And so you see a little bit of the two sides of the coin there in that playing out. So that's been, a different sort of economic picture for them. The other parts of the system, whether it's the health IT companies that are the underlying infrastructure and providers to the system more broadly, pharmaceutical providers, and so depending on which part of the pharmaceutical chain that you're in, if you are focused on dealing with things that can be adapted for pandemics and dealing with coronavirus specifically, then there's a lot of funding and there's a lot of focus on that and a lot of interest on that. Other parts of the pharmaceutical therapeutic chain are seeing resources being diverted from them. So again, puts and takes on that in terms of where the benefits are. And medical device manufacturers also has been another part of the chain that's been pretty negatively impacted because their buyers are hospitals. And so as the hospitals are trying to go day to day here in terms of managing their cash flow, there are not a lot of medical devices that are being purchased as a result. So it's a complex picture. You've got, red, you've got green, you've got pros and cons, but it's a complex economic picture overall just in terms of what's been happening. And it's a similar story as you start to look beyond 2021. So on this, a couple places I want to double click and provide a little bit more detail. So the first part of it is on the hospital and on the providers as I was talking about. So thinking about just to give an illustration for how much this crisis really has impacted hospitals, a couple of things to note about the way that hospital systems work. First of all is that pre-COVID, 30% of hospitals operated at a loss. So they already are surviving basically because they have nonprofit foundations that are supporting them, but their margins are actually not positive. So that's kind of ingoing. You got almost a third of the hospitals in the market aren't making money even above a threshold level. Another 50% of the hospitals out there have had a margin pre-COVID less than 3%. So it's a very, very thin margin business, high fixed cost. It's one of those industries where I'm sure whatever financial modeling that hospitals were doing on shocks or different crises that might happen probably never contemplated shutting the hospital down basically for a period of time. That's exactly what happened as a result of COVID. So you can see on the chart here where the lines start going down roughly in the middle of March. The parts of the revenue streams for hospitals that dropped off are the gray shaded area there around elective procedures. And so as elective procedures basically went from about 20% of hospital volume to 0%, that meant roughly also that hospital profitability dropped even more than that 20% because the elective procedures are where hospitals have the highest margins, where they basically subsidize most of the other parts of their operations. So basically the one profit pool in the hospital went away overnight in order to clear the decks to serve COVID patients. And then that has gone on, basically for an extended period of time, 8 weeks in some cases, and likely to continue on further. One hospital that I was talking to yesterday actually had, basically closed everything down in the entire 500-bed hospital, and they have 8 COVID patients in right now. So, they are trying to figure out now how to play this going forward. But then taking that forward, and you can see the rest of the forecast chart on our graph here, is that as we move forward and things become a little bit more stabilized in terms of the number of COVID patients entering hospitals and we enter the recovery period, that's when the elective procedures will start to pick up more, and some of the cash flow issues that hospitals are under will be alleviated a little bit. But there's a big risk that if you think back to the chart I showed, which was sort of the up and down and the spikes in cases that could come in the fall or afterwards, if we enter another period like that, then it's likely that what we saw from the hospital perspective in COVID peak 1 will happen again in COVID peak 2, and it'll be another point of crisis on the economics for hospitals then. So quite dire straits overall for hospitals. We've already seen some hospital mergers. There's one in California that happened 2 weeks ago. There was another event in California where one of the local payers, the Blue Cross plan, purchased a large provider system called Brown and Toland. So you're seeing basically selling hospitals, M&A activity, lots of loans, lines of credit that are being taken out, anything to do to sort of stave off the cash crisis that has hit hospitals. So overall, a pretty grim picture from an economics and business standpoint for hospitals. From the payer side, all is not rosy on that, although they have had it, our payer clients have had it easier from the economic standpoint than providers have. But the big thing for payers, and what's important to note, just in thinking about what the new normal is likely to ultimately emerge as, is that healthcare payers primarily earn their money from insurance policies that they sell to the employees of employers. So basically, most people in the U.S., the majority of people get commercial coverage through their employer in some form. And in an environment where you see a 20+% unemployment rate, which is what we're at now, and likely to go higher in the short term, you start to see a very significant drop off in the number of people that are employed, therefore the number of lives that are insured via commercial health insurance. And as that happens, so if the commercial health insurance pool for health plans is something like half or 60% of the overall members, that's more like 80% of their profitability is coming from that part of their business. And as that employer group, the gray bar on the chart here, drops off, then that has a disproportionate impact on the profitability of insurance companies, which then evaporates their profit again, which starts to get into the same sort of doom cycle that I was talking about with the providers. Payers they are in general better capitalized than providers. These are insurance companies after all, so they do know things about risk and risk mitigation and risk management. So they're in better financial situation that way in terms of their overall strength. But this is, make no mistake, this is going to be something that severely impacts their business on that dimension. The other side of it for them is that where are those employees going that, or the people going that leave the commercial group insurance? And, they are, some of them are likely to purchase insurance in different ways, either on an individual market. Many of them will qualify for Medicaid, so government programs that way. And unfortunately, many of them will go back into the ranks of the uninsured, which, which obviously is already large and is likely to spike out as a result of this. So our financial models right now, and we've modeled this. It's safe to say COVID-19 is probably the most modeled event in probably the history of business at this point. There's all kinds of different models for taking a look at what the economic impact is going to be, what the case rate is going to be. So any which way you slice it, it's not going to be a pretty picture in terms of what the short-term unemployment is. So our forecasts are someplace around 20 to 25% by year end, which is in the realm of Great Depression kind of levels of unemployment. That's the real bad news. The good news is that structurally, our belief is that this unemployment model is different than previous ones. This is not the Great Depression we're going into, but it is something where there is going to be a shorter term snapback, or at least I think the latest thing that they're talking about in the press now is the Nike swoosh, where it's going to be a gradual tick up. But temporarily, or at least for the short to medium term, call it the 6 to 12 months, it's going to likely be pretty severe as the economy is starting to crawl out of the hole that we've gotten into here. So where does this leave us then? Back to the question of the new normal. And I've talked about some of the transition period that we'll be in. We've talked about, touched on briefly some of the uncertainty that's around trying to forecast anything like this and what this means longer term. But it's likely that there are a few things which are relatively safe bets that are going to happen in one form or another. So from the societal impacts piece of this, we're likely to see fundamental changes in the way that people think about the world in terms of their risk aversion and economic conservatism. In the same way that small businesses have, struggled with a liquidity crisis because their cash flow was their lifeblood, and not having that for a month or 2 months can be devastating to their business. This is something that people are realizing on an individual and personal level as well. So it's likely there's going to be a mind shift around that. There's going to be differences in the way that people work in the future. I mean, you're already seeing companies like Uber saying they're going to have a work from home indefinitely or permanently for what they have. So there's going to be a change in the way that companies are thinking about office space and the need for people to be in offices at the same time. And how to do that safely and how to do that consistently. It's likely that you're going to see a difference in just the philosophy around where people live. So the urban versus suburban, and are people going to look at this as a way to say, well, if I can work remotely and I can cut commute time out, and it's less expensive to not live in San Francisco and to live someplace where I can get more land and have a bigger house and have a lower cost of living and all the rest of it. Is that going to permanently change? I think that's going to cause businesses to take a look at this and cause people to take a look at this differently in the next generation. Large groups, sporting events, all of those things, which I'm sure everyone's been sort of reading about in the press, all of those things I think are going to be rethought about what's the safe way to do those things. Social norms, the death of the handshake, right? Are we ever going to shake hands again and do things like that, which have just been part of our culture. So all of these things are likely, at a very, very fundamental level that sort of change things, or at least cause a rethink of things going forward. I know, higher education, right, or education in general is another, example of an industry that is going to need to rethink the way that that service is delivered, that the educational experience is delivered, and how do you do that in a way which is, which is safe, which is respectful, which also, retains all the things about that which have been great for so many years. But you can already see you can already see some of the changes that are being considered and how to deal with this. So those are macro things on the societal level, and a lot of those translate down into healthcare, new normal as well. So things related to getting care of service, not necessarily in a face-to-face kind of setting. So things like digital care. I mentioned the growth of telehealth, the dramatic change in that. And it's likely that digital health is going to go for something which was, roughly 4 to 5% of people had used digital care, videos, video chat, telephonic chat, etc. It's likely that that is going to spike up a lot. One of the things that we've always seen in our research, at least for the past 5 years or so, is that once people try telehealth or try something like that, they like it, and they tend to be a consistent user of that. And now that so many more people have tried it, using that and extrapolating that, it's likely that we're going to see digital health becoming more mainstream as opposed to something on the fringe. Even my 80-year-old father, by the way, who's a retired endocrinologist, has gone back to serve patients and is now doing telehealth services for his 80 and 90-year-old patients. So you can teach an old dog new tricks if the necessity is there to do it. So it's likely digital care is going to be part of the normal. It's likely we're going to see fewer hospitals. There's probably going to be a wave of community hospitals that are going to be forced to close for economic reasons, and they're either going to consolidate or they're going to have to change the way that they're delivering service, and things are going to have to become more remote that way. So it's likely that's going to happen. It's likely that insurers are going to buy providers also. So you're going to see more integration of the insurance function, the risk function, and the care delivery function. And that's something we're hearing a lot about with our clients as well. It's likely that, and this is not any kind of a prediction for Medicare for All or any sort of government program around all health insurance, but it is likely that there is going to be a shift towards more government programs and more people being covered by things like Medicaid or Obamacare, the ACA. So those are things which are likely to be part of the new normal as well. Pharmaceutical companies, I mean, you're going to see as a result of this, I think one of the positive outcomes of this is going to be a rethink of the way that that drugs are brought to market, and some of the innovations that are already being driven through on fast tracking drugs and getting things done more quickly has been tremendous in terms of the ability to do this in a way which mitigates risk and does all the appropriate things that you need to do in drug development, but also enables you to address things more quickly from a public health standpoint. And then the last couple things on here, again, these are fundamental things, and we could spend all day talking about any one of these bullet points on here, but it's likely to see a shift to at-home care and doing things outside of the clinic setting to provide care services. So whether it's remote monitoring or whether it's in-home services that are provided by clinicians, all of that is likely to be more common as we go forward, and we try and reduce the risk that the people most at risk face when they're congregated together in spaces. And new products is the last thing on here also. And there's already with our clients, a lot of the work that we're doing right now is on thinking about other ways that our clients, that we can help customers mitigate risks in the future. So things around new ways to have for future pandemics, which unfortunately there will be future pandemics. How can you have specific products that enable you to get initial care covered or hospital stays covered or things like that, which today may not always be covered based on insurance policies. So across the board, lots of things which are in the field of play here for the new normal. I'll end here and pass it back over to Jeff by the last comment saying that we're still very much in the fog of war right now with everything that's been going on. And so take these predictions for what they're worth right now. They may be different in a week. They're changing very frequently as we get more information and learn more. But anyway, this is the latest thinking that we have, and doing the on-the-ground work with our clients, and rolling up our sleeves and trying to figure out how to proceed forward from where we are today. So with that, Jeff, let me turn it back over to you here.
Okay, well, thank you, Chris. It gives us something to think about as we move beyond the current environment into the future, how some things may change for us that we'll be adjusting to as we move forward. Given that, I'm just curious, I'd like to get your thoughts on, given the changes that you perceive, what sort of advice would you give to students who are contemplating their futures from a career perspective?
Yeah, well, so a couple of things. And first of all, congratulations to the class of, I guess it's 2019 and 3/4. I heard you're calling yourselves. Sorry, caught right in the middle of this and didn't get to attend graduation in person, but congratulations to all recent graduates. And my general comment is that long term, the healthcare industry has never been more exciting, and I think nothing about this changes that. I got into it, as an English major from Middlebury, right? It's like, how did I end up in healthcare? Don't you have to be, a science person or all that? And I think that for any liberal arts person thinking about spaces in the markets and places where there's really interesting stuff going on and endlessly challenging problems and what you see in healthcare. And healthcare is endlessly challenging because you've got you have so many different constituents that are impacted. You have patients, you have hospitals, you have doctors, you have the government, you have insurers, you have businesses. It's like everything is involved in this complex ecosystem about how is healthcare paid for and delivered and how to do that in the best way. So all of those opportunities long-term are, it's a wonderful industry for that. And I would continue to recommend that for anyone. In the immediate term, for people that are trying to get their foot in the door right now and get into the industry, there are some places where there's immediate opportunities, immediate areas of focus. Health IT remains a real active space. People that are interested, for those that are interested in doing research and and things like epidemiology, as you were saying, sort of as we were talking about this earlier, right? People that know what an epidemiologist was 2 months ago, now everyone's like, wow, that's a lot of interesting stuff going on. So those kind of science opportunities and research are really interesting places to go. People that are interested in being clinicians, physicians or nurses or PhDs that are doing clinical work, all of that continues to be really, really important stuff and opportunities in the short term. And all the schools, for people that are looking at postgraduate kind of stuff to learn about public health or to learn about any of those clinical degrees, again, those kind of opportunities, those remain, just as viable as they were 2 months ago as they are right now.
Okay. So Chris, I appreciate you sharing your thoughts with us. It's always helpful, particularly for our students as they think about their futures, to get the perspectives of someone who's out there in the world, seeing it and living it every day.
All right, well, it's great to be here. Thanks for having me, and good luck anyone. And I'm in the Middlebury directory, so you know how to reach me if anyone has questions.
Thank you, Chris.
Thanks.
This episode concludes the series, Exploring Careers in Public Health. I wish to thank the following individuals for making this series possible. Of course, all of the professionals who contributed to each episode. Secondly, Fariha Haq and Bridget Leahy in the Middlebury and DC office, and Nicole Vayu, Assistant Director of Communications and Outreach for CCI. In closing, I want to thank you, our viewers, for tuning in to hear career perspectives and advice from a number of professionals in a broad variety of organizations in the field. I also want to encourage you to tune in to the other MIDDVantage series, which will be airing throughout the summer. Next up, we'll be exploring careers in international development, followed by the series Careers on Capitol Hill. Until next time, I'm Jeff Sawyer. Thank you for watching, and be safe.